This is Let's Read, an overview of the successes and challenges related to supporting Indigenous communities in Canada through research. It is a report written by Jeff Redding in 2022 and submitted to the BC COVID-19 Strategic Research Advisory Committee. In light of unprecedented COVID-19 pandemic-related interruptions and upheavals across the global Indigenous communities, this is an opportunity to reflect from the standpoint of governance on research and management perspectives, on respective organizational roles and practices, and the context of the pandemic and its impact on Indigenous communities. These reflections are informed by rapid developments in health sciences research disciplines connected with access to health services and the wider Indigenous human rights and social justice context. It is a challenging landscape to navigate public health research and meaningful Indigenous community engagement. Steady progress has been achieved in building partnerships for Indigenous-led advanced research in British Columbia. Innovative pandemic projects often require biological measures as an adjunct to epidemiological, health services, and qualitative research to enhance Indigenous community/tribal-specific public health context measures. Balancing community priorities with scientific excellence requires engaged technical advisory boards who must ensure scientific excellence, community relevance, and compliance with Indigenous governance referencing OCAP, which is ownership, control, access, and possession, data sovereignty principles, including community ethics review and full compliance with Tri-Council policy statements on ethical conduct for research involving humans, specifically Chapter 9, Research Involving First Nations, Inuit, and Métis peoples. Adhering to widely accepted iterative research engagement protocols that govern current and future research partnerships involves Indigenous nation-based consultation in which academic partners are working to support community capacity to advance scientific technical functions. The unfolding impact of the COVID-19 pandemic on Indigenous communities and the urgency of responding to the pandemic created a challenging context for governance and community consultation. On a practical level, the absence of trust-building face-to-face meetings and short time frames are complete departures from Indigenous community consultation protocols. Indeed, the wider legal, political, and social context became a focal point for long-standing frustration among Indigenous communities around health inequity and cultural safety, a history of exploitative and unethical research relationships, jurisdictional uncertainties, and lack of capacity underpinned by divisive competition for resources. The pandemic has universally exacerbated and revealed social and economic rifts and disparities, often intensifying household economic hardships, heightening mental health burdens, driving social unrest, and galvanizing activism across BC, Canada, and abroad. These factors, alongside constantly shifting predictions on the COVID trajectory, duration, and impact of the pandemic, created an unpredictable and challenging environment. Deficits in emergency response protocols, jurisdictional uncertainties, capacity deficits, and unmet cultural safety needs may have been a barrier for the implementation of OCAP-informed Indigenous health research. The pandemic has created an opportunity to catalyze change for a renewed relationship between PHAC, which is the Public Health Agency of Canada, and Indigenous peoples based on reciprocity, guided by UNDRIP, and in fulfillment of fiduciary duties. There is an urgent need in confronting the global meta-challenge of emerging diseases, climate change, and economic inequality to engage Indigenous peoples as scientific partners. Although efforts have begun to train a new generation of Indigenous scholars able to navigate across worldviews and to build research and governance capacity in Indigenous communities, this burden cannot be assumed by academia alone. Academic institutions risk being in the line of fire when long-standing conflicts over jurisdictions and resources flare up and historical wounds are reopened. Yet it's not the task of academics to mediate these. Rather, the Academy has an important supportive technical role to play in transforming these tensions through advances in transcultural governance, research ethics, advanced education, and transdisciplinary health and social sciences. The BC research community is now actively working in service to Indigenous leadership and stands ready to continue moving forward with the projects and partnerships. The urgency of the pandemic compelled Indigenous communities to use existing but often stretched health resources to plan responses. For some, this involved a degree of turning away from already mistrusted biomedical and institutional responses and leaning into cultural relationships and traditional medicine. In a normal year, summer is traditionally the season when communities regroup and concentrate on land-based activities, which limits the time invested in our outside collaborations. The pandemic gave extra impetus to this seasonal shift as some urban indigenous people returned to communities in great numbers, accompanied this time by a wider mainstream flight from cities to rural areas, and began focusing energy and resources on grassroots responses. The pandemic was not, for some communities, the only public health emergency unfolding. COVID-19 exacerbated the overdose crisis, health and social service inequities, and impacts of environmental disasters, and came at a time of heightened activity for activists, land defenders, and those involved in resource conflicts. Amidst all of this, community academic research partners began to navigate concerns around data sovereignty and to question the wider governance framework of COVID research projects. A way forward involves the considerable diversity of a challenging political environment, making progress for project management that will continue to be iterative and adaptive. It's no accident that the indigenous peoples who have committed leadership to COVID projects have well-established data governance capacity under tripartite agreements and are well-positioned to envision the rollout of an epidemiological survey and biospecimens, along with its complex communication and engagement requirements and ethical governance of data. Even for indigenous leadership, however, the challenges are unprecedented and the terrain unpredictable as concerns shift to new hybrid vaccines, potentially new variants, and the unfolding, potentially devastating socioeconomic and mental health impacts on elders, children, and youth in schools and so on, of pandemic on highly affected communities. From the perspective of management and coordination, pandemic research with indigenous communities requires as much innovation and ongoing reflection and learning as do the governance and methodological components of the COVID research projects. The academic institutions must remain committed to removing barriers to health research, to evaluating indigenous knowledge, and to community engagement, recognizing that adaptive, inclusive, and respectful research management is crucial to realizing this. In conclusion, protocols and ethical principles governing partnerships between indigenous and non-indigenous entities, including government, academic, and other research-intensive institutions, came under scrutiny and were severely tested during the COVID-19 pandemic. This happened against a historical backdrop of deep mistrust of medical and public health research within indigenous communities, of its utility, intentions, and applications of culture and cultural safety. Moreover, at a critical political moment in Indigenous Canadian relations, with the reading of Bill C-15, a federal act respecting the United Nations Declaration on the Rights of Indigenous Peoples. The unfolding pandemic already forced communities to make choices regarding health resources and capacity on short notice and without adequate consultation. Clearly, work needs to focus on adapting to urgent pandemic conditions with strict adherence to Indigenous ethical principles, e.g. OCAP, for example OCAP, in which future pandemic surveillance and response systems will require much more preparatory work, ideally before a pandemic begins, to establish the aims and technical details of research according to governance and community engagement protocols. These cannot be bypassed, even in the context of a global public health emergency. A unique opportunity nonetheless has occurred to meet Indigenous leadership as partners in their pandemic readiness committed to community-led COVID research and service to community, to become navigators of infectious disease surveillance and community responses, engaged to proceed with the public health surveillance intelligence required to further advance assessments and filling of capacity deficits. Whereas some Indigenous communities may categorically decline to participate in research scenarios, it does not preclude the ongoing need for surveillance of inter alia, emerging coronavirus variants, vaccine efficacy, and the long-term and syndemic impacts of COVID-19 on Indigenous people's health. In short, Indigenous communities should have equal opportunities to initiate, manage, and control the outputs of pandemic research, including surveillance, regardless of where the COVID-19 pandemic currently finds them, and regardless of their readiness to participate in the current projects. Indigenous peoples have worked long and hard to establish norms and standards for research that aims to be supporting of Indigenous communities and key institutions that are moving forward to achieve their research mandates without overstepping the boundaries of ethical practice and supportive partnership. These ethical standards have been implemented at federal institutional levels, for example, through Tri-Council Research Ethics in BC, through harmonized research review processes, and at the CIHR, the Institute for Health Research, Canadian Institutes for Health Research, Institute of Indigenous Peoples Health, Iterative Peer Review Committee. What is required now is for us to commit to undertaking this journey together, learning from our experiences with COVID-19 to support the current pandemic response and to prepare for the next one. The end.